All right. Hi. Good morning, everyone. Welcome to week 2 of the Redefine Wellness Workshop series. We are now going to discuss about a very popular topic in wellness. And today I will be joined by Kim Sims, MD. Dr. Kimberly Sims is a physician, best-selling author, speaker, coach, and wellness champion. She enjoys working with women who have been sacrificing self for service and helping them to disrupt the cycle of overwork, perfectionism, and superwoman syndrome and choose wellness, purpose, and peace. She was born and raised in Tyler, Texas. She received her Bachelor's of Science in Psychology from Baylor University while participating in two honor colleges. She earned her MD at the University of Texas Medical School at Houston, now McGovern Medical School. She completed her internal medicine training at Houston Methodist Hospital and further trained and certified in weight management. Dr. Kim has served many roles as a primary care physician, faculty to residents and students in committees with her employer and professional organizations. She was recognized by her peers as a rising star in Texas Monthly 3 consecutive years and was recognized as 2020 Early Career Physician Leader of the Year by her professional organization. Dr. Kim became even more passionate about wellness and the mind, body, and spirit balance required when she encountered her own health struggles, worsened by her lifelong struggles with perfectionism and playing superwoman. Since then, she has found joy leading workshops on wellness, like what we're doing now. She has written a book about her story in the Amazon best-selling anthology, When Destiny Needs an Intervention, Volume 2. And she coached women to better health by combining her knowledge as a physician, a certified coach, and a recovering perfectionist. She's also a proud wife and a mom of two handsome boys, and enjoys reading, traveling, working out, writing, singing, and time with her family and friends. Ladies and gentlemen, I welcome you to this workshop. And Dr. Kim, thank you so much for hosting our week 2, Redefining Self-Care. We are so honored and excited for you to be here.
It is a pleasure. I'm honored that you asked. Thank you for having me. And I think maybe we'll just hop right into it. Yes.
Yes.
So I am looking for my mouse. I don't see it. Huh. I'm going to, well, let's see. I know what's going on. There, that's what's going on.
It always happens. I think we're all used to it now. We tested earlier, guys. It was smooth. So
Okay,
it's good.
there we go. So I am going to speak about redefining self-care. And I think it's important that we talk about this because when we think about self-care, when we see self-care discussed in popular, like popular articles, when we see it on social media, we really see it as like people talk about getting a massage or getting a facial. They'll even talk about some things that we can do, kind of short things like read a book or take 5 minutes to yourself, which those things are all important. And I don't want to downplay those things because they are a part of self care. But I will tell you that self care really is something that is continuous. And one of my favorite things that I read that really changed the way that I thought about self-care and thought about creating a space for myself was that self-care is really creating a life from which you don't need escape. So it's creating habits and creating space in your life so that you're not thinking that you're escaping your life when you do these things. It's that this is your life. And so that's kind of how we will enter this space. I'll start with my story. And this is actually a picture of me in the middle of my health crisis, is what I'll say. Um, the end of 2018, I cut all my hair off. I had always had long hair, and I was starting to get a little overwhelmed. I had a little one who he had just weaned, and he had not slept until he weaned through the night, and so I was exhausted. At that point, my headaches had gotten ridiculous. Um, and I just didn't feel like we were building a house as well, and I worked full time. And so I was like, I don't have time for this hair. My hair wasn't really thriving the way I wanted it to, so I cut it all off. And in May of 2019, I started to have a migraine. Well, I started having worse migraines after a car wreck. My doctor recommended that I take some time off, and I told her I didn't have time for that. I had students, and I had a student coming from my professional organization, and I had residents that were in my clinic twice a week. And I just didn't know what was going to happen with them if I was gone, and I don't have time to take off. No, I'll be fine. And so I continued, and then I looked up, and I had had a headache for 40 days. And in that 40 days, I was waking up at 5 o'clock. I was walking my dog. I was exercising. I was getting my kids ready for school. I was going to work. And then I would come home and I would cook dinner. I would help with homework. I would get them in the bed and I would go to sleep. I would do it all again with a headache. I was waking up with this headache. I was going to sleep with this headache. And I would do that until I would be at work and I'd be in so much just distress, because a migraine is more than just this headache. It's nausea, and it's vertigo, and it's just stomach discomfort. You feel it's so much, guys. It's really pervasive. You have brain fog, and so I would get to this point where I didn't feel like I could make medical decisions, and I would say, okay, now I have to go home because I'm not in a safe place. And so then I would take off half a day, and I would sleep it off, and then I would start all over again. I did this for 40 days before I decided it was a problem. Okay. And so then I went to see my administrator, and I was like, I think I need 4-day weeks or something. I need more rest. This headache won't go away. And she looks at me like I'm crazy and says, you need to take off. So I contacted my doctor, who had no problem with it because she had already told me to take off. And I was out for 4 weeks. And I realized that I had forgotten how to listen to my body. I did not eat when I was hungry. I did not go to the restroom when I needed to go to the restroom. I just was not listening to my needs at all. And was out for that first 4 weeks. Headache did not go away. And I returned. And in 10 days, I was pulled back out because I ended up in 10 out of 10 pain at work on the floor. And my doctor was like, yeah, come on back out. I told you I wasn't really comfortable. And so I was out for another 4 weeks. That time, so much worse. I couldn't even interact with my family for about 7 to 10 days. I was in the dark. Um, and I tell people, being in the dark for that long really will take you to a different kind of a place. And I am I'm Christian. I tell people, and so I was talking to God during that time. But it was really a transformative place where I learned that I needed to step back, to not need to be in control all the time, and to really approach self care in a different way. And so I say that learning the real definition of self care helped save my life. And I realized that self care really equals self love. because one thing that I realized when I was wondering if I was going to be able to continue to be a doctor, when I wasn't able to care for my kids, is that, and one thing that my administrator said to me actually was, would you let your patients do this? I didn't even care for myself as much as I cared for my patients. And so really think about that, that when you spend time caring for yourself and making space for yourself, what you're really doing is loving yourself. And we are supposed to love others the way that we love ourselves, which means that we have to love ourselves first. We are giving from a full place. We have to love ourselves first. So self-care equals self-love. And what does love look like, right? So love means acceptance. The first thing you have to do is accept your flaws. It is okay if you mess up. It is okay to be imperfect. It is okay to be sick and take a day off. And so it's really stepping into your humanity and allowing for your humanity. And so accepting yourself. Love means discipline. And so I actually had a revelation before I came here, because the first time I gave this talk, or gave kind of thought about this, I thought about it in a different way. But I was like, well, what if they're thinking about it as their partner, right? Well, if you're thinking about it as your partner, it also means honesty and consistency, right? And I think about all of that as being in this same place: discipline, honesty, and consistency. And so this is the part that makes me say that self-care isn't necessarily about those glamorous things that we think about. Self-care is about making space for eating healthfully. It's about making space for going to bed on time. It's about making space for exercise and going to the doctor. And part of the reason I bring this up is because for me, this was huge. It was huge. And we don't really think about these things as self-care. We think about the fun stuff as self-care. But for me, when I went to my neurologist, on the list of things that I needed to do was stuff that I tell my patients to do all the time. I needed to get regular sleep. I needed to go to bed at the same time and wake up at the same time every morning, or I was more likely to have headaches. I needed to exercise regularly. I needed to make my doctor's appointments, and I needed to eat healthfully. Those were all things that would help my headaches be better. But they're also things that help us feel better. So I want to go through just some of the things that, when we're trying for our self-care, we're trying to do things. Exercise improves memory, thinking skills. It improves depression and anxiety. It improves insulin resistance, which is your blood sugars. It also improves blood pressure, memory, and thinking skills. I think I already said. Insulin resistance, I already said. Let me see. Um, And so what I want to talk about, we need 150 minutes of cardiovascular exercise if you're doing moderate intensity. And so I have talked with someone recently. We were talking about different heart rate measurements that you need for that. I was coaching someone, and the heart rate that you want is about 50 to 70% of your maximum heart rate when you are in that moderate intensity place. And so that is 220 minus your age. And then that would be 50 to 70% of that. If you are doing higher intensity, so that's 70 to 85% of your maximum heart rate, then you only need 75 minutes per week. So I tend to like to do higher intensity because I'm busy and it means I don't have to do as much exercise. Strength training, you want to make sure to get some of that in there. I have the lady with the weights because, sometimes we're like, oh, I don't want to get bulky. One, strength training does not make you bulky, but two, it also helps with your bone density. It helps you build muscle, which will help you burn fat. and keep your body just in a healthier proportion. So, strength training is important. You want to do that about 2 to 3 times a week, and it doesn't have to be with weights. Honestly, I would consider yoga strength training with some of the poses that you do. Flexibility as well. You want to get that in. And so I was actually thinking when I was planning for this talk that yoga is one of my favorite things because depending on which type you're doing, um, you can actually get some cardio, some flexibility, and some strength in a
Right.
yoga
It
session.
is a complete workout for sure. There are
So
like workouts where I'm like, this is hard.
exactly. I love yoga. Um, I also tell people don't feel like you have to be all or none, because it can be really daunting. Remember that anything is better than nothing. So don't not exercise because you don't feel like you can get all 150 minutes in for the week, or you can't get all 30 minutes in for the day. If you can get 10 minutes in, that's better than no minutes. And there was actually a study that showed that 7 minutes of jogging improved cardiovascular risk, and just 7 minutes a day. So anything counts, guys. I also tell people do something that you love. So you don't want to do the treadmill. If you hate a treadmill, don't buy a treadmill. If you hate a treadmill, I had patients that were using their treadmill as clothes hangers, and don't spend the money on something that you're not going to use. Yoga, if you like yoga, I tell people turn on YouTube and dance. If you like to dance, play with your kids, go out and do basketball, garden, do something that you're going to do consistently, because like I said, love is consistency, discipline, or honesty. um, and the honesty is you have to be honest with yourself and know that you need to step it up, right? Sleep is foundational. You are not going to be healthy if you're not getting good sleep. You're not going to feel good if you're not getting good sleep. And it supports a healthy immune system, a healthy memory, sharp thinking. It helps you feel less stressed, and it keeps your stress hormones in check. Those stress hormones are called cortisol. And so cortisol actually increases your blood pressure, it increases your blood sugars. It helps promote weight gain. It makes you hungrier when your cortisol levels are high. And so this is another important piece of self-care. When I talk about, the sleep, and why I bring it with self care, you have to make the changes to be able to get in bed, right? It decreases inflammation, it decreases our sensitivity to pain, and it helps our body repair and heal. We need 7 to 9 hours, not six, not five, 7 to 9. And so when we sleep for 6 hours, we have a sleep deficit that it takes our body 2 to 3 weeks actually to make up on a sleep deficit. So really you want to make it a habit to get your 7 to 9 hours. I also like to include rest and play. These are moments of meditation and mindfulness. Naps are also evidence based. So, like a good 25-minute nap can really help you feel refreshed and keep your mind sharp if you can plan for that. Um, All right. And then I also have your screenings. You want to make sure you stay up to date on your cancer screenings, because I always say for everything, it is Breast Cancer Awareness Month, but this is any cancer. Early detection does save lives. The earlier we find a cancer, the better we can treat it. And so you really want to be in your doctor's office, being screened for high blood pressure, being screened for diabetes, and being screened for your cancers. So I have this because I say sometimes it means that you gotta kick yourself and get going. Love means communication and care. So like I said, one of the first things that I realized when I came off work was that I was not listening to myself. And you really need to stop a few times a day and check in with yourself and say, what do I need? Do I need to stretch? Do I need some water? Do I need to take 5 minutes to myself and just have a mindful moment, or take some deep breaths, close the door and close my eyes? Check in with yourself multiple times a day. Sometimes it's a bigger picture, like, it shouldn't have taken me 40 days to realize that I needed to do something about the headaches. Love means communication and care. So don't just ask, actually do something about it. And love means patience and forgiveness. So you will make mistakes. You will say, I'm going to eat healthfully. I'm going to have my healthy plate, which is half a plate of fruits and vegetables, a quarter of a lean protein of some sort. It can be plant based or animal based, and a quarter of a preferable whole grain, but carbohydrate. And you said you just fell off. It was birthday party month or it's Halloween. You ate the kids' candy, and you're like, oh, goodness. Don't beat yourself up. You made a mistake. Figure out why you made the mistake and learn from it and move on. Because when we love someone, we forgive them, we are patient with them, and we move on. And we should do the same for ourselves. We shouldn't call ourselves bad names. We shouldn't berate ourselves. And we shouldn't kick ourselves when we're down. So just remember that always loving language, always just to observe and to learn from, but never to degrade. Because love is patient and forgiving. So, my 4 S's of self care. The first S is success redefined. So, I'm very big about redefining success because as a perfectionist, I tended to define my success in terms of accomplishments. And so, like when I was in school, it was my grades. And I was president of this and, X of that. And when I got um, to work, I remember graduating residency and saying, well, what next? Because if I didn't have something I was working toward, I didn't know what to do. And so I just kept accomplishing and accomplishing and accomplishing. I got a weight management certification. I had my residence. I was sitting on boards and I was doing, and it was just like, let me do this and let me do this. And for what? And I really had to stop and ask myself, what am I working for? What am I doing this for? And so part of it is stopping and asking yourself, what am I working for? But the other part of redefining success is remembering that success is what you make it. I had a moment where I was sitting and thinking about people like in the middle of the country with their cows and how just happy and content they were. And it made me realize that it's really whatever you want it to be. And I needed to include my values, the things that I truly found important in my definition of a success. And so I started to define success as time with my children. I needed a position that afforded me time with my children. Time for me, because like I said, I'm Christian. And so for me, time with God. But for if you're just, if it's just a spiritual thing, you need time to connect with the source, with a greater source. You need time for that. For me, time for my friend, time to take care of myself and time for my friends. Time to take care of myself was important because I had bad headaches for, honestly, I think I just stopped having bad headaches. I don't know. I had bad headaches for a very long time. And so part of it was I need time to make these doctor's appointments. I need to have the ability to schedule time for myself. And so now success was me holding me accountable to certain things. I needed to make sure I took time off that so that I could be mentally well, make sure that I was connecting, make sure that I was spending time. And so that meant that I needed to do the next step. which was set appropriate boundaries. And so that meant telling people that I couldn't do certain committees, or that I maybe couldn't do this extra project outside, or that, you know, I need help with the kids so I can get to sleep, or they need to go to bed earlier so I can get to sleep because I need this bedtime every day. I need to wake up at this time every day. I need help with the kids because I'm tired and my head hurts. I need you to help with the dog because I'm tired and my head hurts. And so it was really setting these boundaries with work, with family, um, so that I could start to work towards that success. I say schedule it because we will, if we have our own business, we will schedule that to a T. We will make sure that we stick to it. If we are at work and we have meetings, we make those meetings. If we are scheduled to work, like we work retail and we have a schedule for that, we show up when we're scheduled. But when it comes to self care, when it comes to, oh, I was supposed to exercise, or I'm supposed to go to bed, or I'm supposed to stop working at this time, or I need some days off, we don't schedule those. Those things get moved around. And the truth is, whatever you're choosing, you're saying is more important than you. So you really need to sit down and put yourself on your schedule. And the only time that those things move is when that thing truly is more important than you at that moment, right? And so I have time in my morning that is blocked off for my Bible study and my meditation and my exercise. That's my block. I recommend people have time in their morning. My business people, I have an entrepreneur that I'm coaching, and I recommend that she block off 5 minutes. I said, put it on your schedule. This is a meeting with yourself where where you're scheduling your day, like you're sitting down and you're getting your mind right for your day. Do things like that. I told her to put in her schedule 5 minutes to breathe. If you have a busy day where you're running and running and running and running, block off 5 minutes if you have it. That's a meeting with yourself so that you can just take a deep breath. And it's non-negotiable. One thing that I did, because as a physician that gets busy, I would schedule out for like 3 months. I would have patients in my schedule 6 months out sometimes, but it would be fully booked for like 3 months. So I would sit down and for 6 months, figure out which Fridays I was taking a half day off every month for me, for no reason. Because other people get mental health days. And I knew I was not going to cancel patients for a mental health day, but I needed them. Because if anyone's stressed, your physician is stressed. Okay. So I scheduled them. Those are things that you need to do. You deserve it. Schedule your
And
exercise, schedule your meal prep time, put it in your calendar, and don't move it unless that thing is more important than you. And then build your systems and support. And I love this picture because I think it's like both of them at the same time, right?
yep,
So, systems. Because I'm like quality improvement and all of that, I've done some of that training too. I like to remind people, I don't know if people think like this, but your outcomes are only going to be as good as your systems. And if you think about it like that, then you don't beat yourself up as much either. Your outcome is only as good as the system that's there to support that outcome. And so when you say, I'm going to eat healthfully, from now on, I want to, have my veggies and lean protein, and I'm going to do that. And that's going to be the way I live. I'm not going to eat out for lunch. I'm going to take my lunch and I'm going to meal prep. And then you don't do that. Why didn't you do that? Was it that you weren't able to get to the grocery store and get those groceries so that you could make it? Was it that you didn't have time to cook the things that you said you were going to cook? Sometimes it's that you made it and you just didn't want the stuff you cooked. And so it's really looking at, where was the breakdown? If it's that you didn't get groceries, consider grocery delivery. Consider curbside pickup. Something that's just systematic that saves you that time. If it's that you don't have time to cook, or that you just didn't schedule the time to cook, consider scheduling the time to cook and cook a lot at once, or prep the stuff and then be able to just put it in the oven quickly. Figure out what will work for you. If you can afford to, pay somebody to meal prep for you, and then it's done. You can enlist your spouse or significant other. I had someone that did that. They were like, "Oh, he's meal prepping for him and he's not doing it for me," and they were like feeling some type of way about it. I'm like, "Well, have you asked them to meal prep for you since they're doing it already?" And the thing was that they weren't. And when you have a significant other of the other gender, they do not think like us. They are not trained to nurture and do things for other people. Okay? Just ask them. They will likely do it. They haven't even considered that they could make you food. Just say, "Hey, if you could make two of those of what you're making, that would be great." And they'll probably do it. And what they ended up doing was alternating. And so it works now, and they're able to eat healthfully because they put that system in place, and it has been something that they're able to consistently do. So systems are important. And the support, so I also talked about support in that particular example. Her significant other was able to support her in that effort. When you think about needing kids to help, or needing someone to go grocery shop for you, sometimes you can just enlist a friend. I had when I was trying to mail books, guys, I don't mail anything. I'm horrible at it. And I was like, I gotta mail the books. So I had a friend that was like, "Oh, you could have just asked me. I would have done it." And so you never know what people will do for you that you aren't so great at. Use your support system. Ask people for the help you need. You can't be too proud to reach out and say, "Hey, who's good at? Who can help with?" You will save so much time, and you may find that your changes are able to stick because you've reached out and you've gotten support in areas that were taking you a whole lot of time, when now they're not, because now you have the support that you were too scared to ask for.
I love these tips. They are all science-based, by the way. We studied it in the Science of Well-being, and we also talked about it in our first series, the Science of Happiness. So thank you for sharing those for
All right.
SES of self-care.
And
I
I
think
could
this is very
actually
important.
pause for questions now if anyone has them.
Hey, Amber, Francis, and Zenny, do you have any questions for Dr. Kim? This is a free consultation. The doctor is in.
Yes, I've had people ask about anything. So I answer anything health related at this point.
I have to schedule that mammogram and other tests. I've been thinking about it, but it's like that. Schedule it. You gotta
Right.
schedule
And
it.
really just sit down and put it on the calendar,
Right.
and then it's done.
Right. I keep on delaying it. I'm like, it's on top of my head, especially October is BCA, breast cancer awareness, and you're also talking about it. So I keep on getting that reminder. And my former company, that's our advocacy, and I keep on seeing them post. But I know that it's one
Hmm.
thing to know, but it's one thing to act. Like I haven't even called the doctor. I'm sure when I call them, it's gonna be 3 months away,
Exactly. And
right?
that's why
Because
I'm
I
like,
did that
just
for my
call,
kids,
just
and I'm
call.
like, I did that. My kids have this, annual checkup. So we're good at taking care of other people, right? But we're
Exactly.
not taking care. We're not good at taking care of ourselves. So when I call the doctor, I'm like, oh, the next appointment is September. I'm like, oh, okay, let's book that.
Yep.
So yeah, thanks
And
for the
honestly, it
reminder.
sounds like a lot, but I would say even schedule the time to schedule, because
Mm,
that's what I sometimes have folks do. It's like, okay, well, what time do you spend getting your personal things done?
right.
Well, pick time. That this is
Yeah.
just personal activities, because especially when you're an entrepreneur, it's like you're always working on your business. It
Right.
spills into everything. And so pick a time. This is on Thursdays at 12, from
Mm-hmm.
12 to 2. That's the time that I'm going to get my personal stuff done. I'm
Right.
going to sit
And put
down
it
and
on the calendar, right? It's very
exactly.
effective. Because for me, I
Exactly.
put pay car because otherwise I will miss the payment. So maybe if we think of it as we're gonna get penalty, we can
Yes.
get better at it. So I schedule those. I schedule the exercise. When we did the Science of Well-being, there was a 4-week rewirement course to develop a habit, a good
Hmm.
habit. So I chose yoga and meditation, and I just did it consistently, and my brain is now wired to do it, and I keep on, my body knows like, okay, you gotta exercise now. It's because I'm used to it. I don't care what time it is. But before, when I was training my mind and my body, it has to be at a certain time, and I was very, very diligent on that appointment because this is what I learned, right? And it works, guys. It
Exactly.
works.
Exactly.
All right, any questions from the group? All right.
Hello. Hi, this
Hi,
is Zen.
Zen.
Hi. Thanks a lot for the tips. It's pretty good, pretty informative. But for myself, I usually have problem with my scheduling. I usually procrastinate. So, oh, I need to do this. I need to do that. But I usually do stuff for others, and most of the time forget about myself. But
Exactly.
I think I'll start thinking about myself too, like going to bed at a certain time, or getting up at a certain time, which is one of my problems. I usually say, oh, because I'm really getting old, that's why I don't go to bed at a certain time. I don't get so much sleep. But yeah, I need to really uh, take a step back and think about myself too.
Absolutely. Because
Thank
you
you.
can't effectively care for others if you run yourself into the ground. Is one
Mm-hmm.
thing that I tell people. And it's one thing that I learned. Very,
Mm-hmm.
very hard lesson. But when I was at home for 8 weeks, I was not able to take care of the patients that I was trying to take care of, or my kids, or my husband, nobody. And so you don't want to get there. And also, you deserve it. Just remember that.
Yes.
So true. Thanks.
Thanks,
Anybody
Zen.
else?
I think we should keep a promise to ourselves to have
Yeah.
that appointment. And that five, I like the tip of putting the breathe part of it, like
Hmm.
for 5 minutes. You could just pause and just observe your breath. That mindfulness exercise is very, very important to reset, your day. So I think that's about it for the Q&A, and we can wrap it up.
Okay. So I say that if you have ever felt overworked, overwhelmed, overcommitted, anxious, or stressed all the time about your to-do list, exhausted, but don't know how to get off the hamster wheel, like you have to do it all or be it all for everyone, if you find yourself fully accomplished but wondering where it's heading, or find it difficult to take time for yourself, then you are at risk for the superwoman syndrome. And I will tell you that perfectionism is increasing, and perfectionism puts you at risk for the superwoman syndrome. And you see the definition here. And as it says, it's a woman who's attempting to perform perfectly in multiple or conflicting roles or goes overboard in one role. And so I think that our society at this point really helps perpetuate this, right? Um, and pushes us to be all and do all. And we've kind of embraced it and said, hey, I'm powerful. And I say, yeah, I am powerful. But the affirmation that I have taken on is that I am capable of anything, but I'm too valuable to do everything. And so
I love that.
I will be having a free masterclass November 3rd, 7 p.m., and November 19th, 10 a.m. Put down the cape, pick up her life. You can text self-care to 33777. You'll get a poster of the 4S's, and you'll also be added to my list so that I can tell you how to access that free masterclass. And I just wanted to invite everyone to follow me on social media. We can stay in touch.
Thank you very, very much, Dr. Kim, for this wonderful presentation. Thanks for all the tips and the reminder that
Yes,
we should love ourselves and take care of ourselves so we can serve others.
absolutely.
Well,
Absolutely.
you guys know what to do. Reach out to Dr. Kim or email us for any questions.
And the Her
For
Wellness Doc is on. I forgot. I was supposed to tell you guys. Her Wellness Doc is on TikTok. I just joined TikTok,
Oh, yes, you
and
gotta add that.
Kim Sims MD is Facebook and Instagram. So
Got it. Her wellness doc. It means healing.
healed, empowered, restored.
Love it. Thank you very much. Thanks everyone for joining us live, and for those watching the recording, thank you so much, and have a wonderful day and enjoy the rest of the weekend. Bye
Thank you,
now.
Dr. Kim and Kelly. And
Thank
Bye. Thank
you.
you so much.
have a great weekend. Bye bye.
You too. Bye, Amber. Bye, Zen. Thanks,
Bye,
Dr. Kim.
everyone. Thanks.
Thank you.